Hello, my name is Joshua Mugabi. I welcome you to topic 10.3, Sexual Reproduction in Humans. We are looking at learning outcome K. Know the causes, signs, and symptoms, and understand the mode of transmission of named STIs, sexually transmitted infections. Syphilis, gonorrhea, candida, human papilloma virus, HPV, hepatitis B, and HIV/AIDS. We are looking at learning outcome, a learning activity. Learners listen to a talk from a health worker or watch a video clip about common STIs and write a report that includes the following: causes and mode of transmission, signs and symptoms. Common STIs, item 1. Let's look at causes, transmission, symptoms. During a biology lesson, learners listen to a health worker and watch a video clip on sexually transmitted infections, STIs. Learners are asked to gather information about common STIs in Uganda, including causes, modes of transmission, and signs and symptoms. Tasks. Listen carefully to a health professional and take note on examples of common STIs.
At some point, most sexually active people will be infected with human papillomavirus, or HPV. There are over 100 types of HPV, and most of the time the body eliminates infections without symptoms. But some strains can pose serious health risks down the line. HPV causes contact infections, which means the virus stays in the cells near the point of infection rather than spreading throughout the whole body. Since HPV is often transmitted through sexual activity, this usually means the cells of the vagina, vulva, penis, anus, mouth, and throat. We can test for HPV in the cells from these areas, but while testing for the virus is scientifically possible, it isn't common. The main reason is that, while there are treatments for the adverse health effects caused by HPV, there's no treatment for the virus itself. So testing for HPV would yield many positives, and although most of them won't be cause for concern, there is still no treatment plan for clearing the body of the virus. But there are other good ways to protect yourself from HPV. We're going to walk through how HPV can cause harm, who's at risk, and how to minimize those risks. The body's immune system is able to eradicate most strains of HPV before they cause any harm, and without people even knowing they've been infected. Certain other strains, like HPV 6 and 11, cause abnormalities in the cells of the infected tissue, which can develop into genital warts. While these are infectious and require treatment, usually with topical creams, wart-causing strains don't create longer-term damage. But another 13 strains can cause DNA mutations that cause cells to divide at a much faster pace than normal, propelling the development of cancerous growths. The cells of the cervix are especially at risk. Two in particular, HPV 16 and 18, are responsible for the majority of cases of cervical cancer, which is now the fourth most common type of cancer in women. It can take up to 20 years for cancer symptoms to appear, but with regular screening, we can discover cellular abnormalities in the cervix before they develop into cancer. Women over 21 can undergo a regular pap smear, where a sample of tissue is gently scraped from the lining of the cervix to test for abnormal cells. A positive test doesn't mean the person has cervical cancer, but rather that there are irregular cells in the cervix that could develop into cancer in the future. Patients are then either monitored with more frequent pap smears, or, for more severe irregularities, undergo a procedure called a colposcopy. This involves a doctor examining the cervix through a microscope and possibly taking a small biopsy of tissue for closer examination. In some cases, the affected tissue may be removed. HPV infections of the throat may lead to head and neck cancers, but for now, there's no equivalent of the pap smear for the throat. Using condoms helps prevent the spread of HPV during sex, and there are 3 safe, effective vaccines that all target HPV 16 and 18. The vaccine comes in 2 or 3 doses a few months apart, and it's only beneficial if you receive them all. Right now, the vaccine is part of standard care for girls aged 11 to 18 in many countries, though it's increasingly becoming available to boys as well. Adult women and men in countries including the United States and the United Kingdom can opt to receive the vaccine, and evidence suggests that vaccination of women and men could reduce the worldwide incidence of cervical cancer by almost 90%. Researchers are also developing an injection for people who are already infected with HPV 16 and 18, which would target the infected cells to stop them from developing into cancerous ones. So while there's still room for improvement in screening, treatment, and access to each, condom use, vaccination, and cervical screening can each reduce the harm caused by HPV.
We do have a graphic. We'd love for you to walk us through these and talk to us about them.
Sure. So we have HPV, which we talked about a little bit earlier. So that's a virus, and that's what's linked to cervical cancer. Chlamydia and gonorrhea are bacterial infections. These, if you do have them, can be treated with an antibiotic. Syphilis, we hear about a little bit less, but it's still out there. It's another bacterial infection. Right. Herpes is viral. So herpes is it's lesions that appear in the genital region. It's lifelong. Right. So that then if you do get herpes, we would give medication to help suppress it. Trichomonas is one of the STDs that we don't really, there's not a lot of symptoms. Right. A lot of times women will complain like of a watery discharge, and I notice it on pelvic exam. That's treated with an antibiotic, and then we have HIV, which is also lifelong. And
looking at this list, though, are any of these curable or just treatable and you just live with them?
So the curable ones, for the most part, so chlamydia, gonorrhea, syphilis, trichomonas, HPV, like I had mentioned earlier, could be shed on its own, and that's more. We help treat and control. Same thing for herpes, and then HIV, we help treat and control to suppress it, but as of now, there's no cure for HIV.
Okay, welcome back from that explanation with the health personnel. Now we can look at question 2. Record key points on the names of STIs: cause, organism involved, mode of transmission, signs and symptoms. From the explanation that we have had at the other side, at least now we have some key points on the named STIs. We know some STIs as they have mention them. We can try to look for the causes, organisms involved, the mode of transmission, signs and symptoms. Now let us dive into these key points and we try to see the different STIs. We have the STI, their causes, the mode of transmission, and the signs and symptoms. The first one is gonorrhea. Gonorrhea, this one, the causative organism is Neisseria gonorrhoeae, and it is a bacteria. The mode of transmission is through unprotected sexual contact, vaginal, anal, and oral. The signs and symptoms, we have painful urination, there is pus-like discharge, and lower abdominal pain. That is gonorrhea. Then we have another STI, chlamydia. Chlamydia, the causative organism is Chlamydia trachomatis. This is a bacteria, and the mode of transmission is unprotected sexual contact. The signs and symptoms, it is often asymptomatic. There is discharge, there is pain during urination, and also abdominal pain. The third STI, we have syphilis. And syphilis is caused by Treponema pallidum, which is a bacteria. The mode of transmission is through sexual contact. It can be through a mother to child, what we refer to as congenital. The signs and symptoms, they are sores or chancres, rash, fever, and fatigue. Then we have trichomoniasis. The causative organism is Trichomonas vaginalis. This is a protozoa, and the mode of transmission is through sexual contact. And the signs and symptoms, they can be vaginal or penile discharge. There is itching and irritation. Another STI is HIV/AIDS. The causative organism is human immunodeficiency virus, and the mode of transmission is through sexual contact, blood transfusion, and mother to child. Signs and symptoms, early, it is flu-like symptoms. Then later, there is weight loss and frequent infections. Then we have another STI, herpes simplex virus, HSV. The causative organism is a virus, and the mode of transmission is through sexual contact. The signs and symptoms: there is painful blisters or sores on the genitals or mouth. Then we have another STI, is the human papillomavirus, HPV. The causative organism is a virus. It is also through sexual contact. And this one, the signs and symptoms, they are genital warts. Some types cause cervical cancer. Let's now look at the key message. STIs are infections spread mostly through sexual contacts. Knowing the causes, the mode of transmission, and the symptoms helps in early treatment and prevention. Skills demonstrated here. There is the listening and observation skill, and that one is acquired during the health talk or video observation. Then we have the research and information gathering skill. Through reading of different books, leaflet, reliable online sources, we acquire research and information gathering skill. Then we have the critical thinking and analysis skill. This one is obtained by understanding the causes, the symptoms, and the transmission. Then we have the communication skills. These ones are observed through report writing, filling the tables, and drawing diagrams. And lastly, application of knowledge to promote reproductive health awareness. Thank you very much for participating in topic 10.3, sexual reproduction in humans. We have been looking at learning outcome K. Know the causes, signs, and symptoms, and understand the mode of transmission of named STI, syphilis, gonorrhea, candida, human papilloma virus, HPV, hepatitis B, and HIV/AIDS. We have been looking at learning activity. Learners listen to a talk from a health worker or watch a video clip about common STIs and write a report that includes the following: causes and mode of transmission, signs and symptoms. Please visit me at Mugabi Joshua Biology on YouTube. Don't forget to like, to share, and subscribe.